Common signs and symptoms of liver cancer. The liver is an organ frequently affected by tumors. It's not only a common site for metastasis from various cancers but also prone to developing primary liver cancer. Notably, liver tumors often manifest specific symptoms, aiding in early detection and prevention. In this video we will look deeper into the common symptoms of liver tumors. Imbalance in liver function evidenced by signs like jaundice, loss of appetite and unexplained weight loss. These symptoms typically arise when the liver fails to filter and process toxins, indicating that tumor growth might be exerting pressure on or damaging liver cells. The sensation of pain or discomfort in the upper right abdomen where the liver is located. The growth of a tumor can put pressure on surrounding organs, leading to inexplicable pain or discomfort. This could be an early warning sign of tumor development. Finally, we'll discuss the causes leading to the development of liver tumors. Factors such as chronic hepatitis, exposure to toxic substances, or excessive alcohol consumption can contribute to an increased risk of tumor development. Understanding these causes not only helps us in prevention but also helps in identifying effective treatment methods. Now let's examine each specific sign in more detail. As healthcare professionals, we frequently come across situations where liver cancer is discovered as an incidental finding during diagnostic tests performed for unrelated reasons. Typically, liver cancer is diagnosed through tests such as ultrasound or abdominal CT scans, which are regularly conducted as part of routine checkups or ongoing monitoring for other abdominal diseases. This is a crucial discovery because liver cancer, including in its early and sometimes advanced stages, often does not exhibit any symptoms. As a result, patients who are incidentally diagnosed with liver cancer may only report a slight decrease in appetite as a very nonspecific symptom. This highlights the significance of regular health screenings, as early detection of liver cancer can significantly improve treatment outcomes. In situations where a large tumor grows in the liver, an increase in the liver's size is often noted. During an abdominal examination, the liver, which is typically shielded by the lower ribs on the right side of the chest, becomes palpable below the last rib. Although usually asymptomatic, the enlargement caused by tumor growth can sometimes create a sensation of weight or fullness in the abdomen due to the increased size. Therefore, diagnostic tests such as ultrasounds or CT scans are crucial for detecting and diagnosing liver cancer, as this type of cancer is more easily observed through imaging methods. This highlights the critical role of imaging in early cancer detection and treatment. Liver cancer can cause pain in the upper right quadrant of the abdomen. This pain is often characterized by a sudden, sharp onset that rapidly intensifies. Typically, it occurs due to a ruptured blood vessel associated with liver cancer, causing internal bleeding that leads to abrupt stretching of the liver's capsule, also known as the Glisson capsule. This stretching activates pain receptors in the liver, resulting in the sensation of pain. However, if there is no bleeding, the tumor grows slowly, which causes gradual stretching and low-grade nerve stimulation, leading to less noticeable pain or discomfort. This underscores the importance of closely monitoring even minor abdominal discomforts, as they can potentially be warning signs of liver cancer. One of the hallmark signs of liver cancer is jaundice, which is characterized by a yellowish tint in the skin and mucous membranes. This occurs when cancer growth disrupts the normal outflow of bile in the liver, leading to the accumulation of bilirubin in the blood. Excess bilirubin tends to accumulate in the skin and mucous membranes, which can be particularly noticeable in the sclera of the eyes, as they appear yellowish or jaundiced. Understanding this phenomenon is crucial for the timely recognition of liver pathology, especially as jaundice can sometimes be the only sign of early-stage liver cancer. Liver cancer can impact the liver's ability to process and eliminate bilirubin, resulting in observable changes in urine and feces. When direct bilirubin in the liver spills into the bloodstream and is subsequently excreted through the urine may appear darker and cola-like in color. On the other hand, when bilirubin cannot access its natural pathway to the small intestine, it inhibits the formation of urobilinogen, the pigment that normally colors stool. As a result, feces may become increasingly pale in color, and in some cases of total bile outflow obstruction, they may turn white. These changes in excretory products can provide important diagnostic clues in assessing liver function and health, particularly in patients with liver cancer. In the field of liver oncology, we frequently encounter a condition called ascites, which is a direct consequence of liver cancer affecting the portal venous system. This system is responsible for transporting blood from the abdominal organs to the liver and can face increased pressure when disrupted by liver cancer. This pressure can cause fluid to escape from the vessels and accumulate in the peritoneal cavity, leading to abdominal swelling. In severe cases, the volume of acidic fluid becomes so significant that medical drainage is necessary. This is because excessive fluid can elevate the diaphragm, impede lung expansion, and cause considerable respiratory distress for patients. As a result, patients with ascites often experience marked difficulty in breathing due to restricted air entry into the lungs. Therefore, those with liver cancer should monitor their symptoms closely, and medical professionals should take swift action to address this condition. As liver cancer progresses, it can behave like a parasitic entity within the body, siphoning energy from the host's nutritional intake. This phenomenon is common to many cancers and results in the rapid turnover of tumor cells, a process that is significantly faster than that of healthy cells. Consequently, our bloodstream becomes inundated with debris from these dying cells. This can lead to systemic intoxication, which manifests in symptoms such as fatigue and weight loss, as the body struggles to cope with the increased metabolic demands and toxin clearance. Furthermore, the presence of these cellular fragments in the bloodstream can interfere with the brain's thermal regulatory center. When these fragments pass through this area, which is responsible for body temperature regulation, they can induce mild fever by disrupting the normal neural activity within this center. Therefore, patients with liver cancer may experience fever, fatigue, and weight loss as the disease progresses. Medical intervention and monitoring can help to manage these symptoms and improve treatment outcomes. One symptom of liver cancer that is often unrecognized is the development of skin rashes. Dermatological manifestations can be a direct consequence of the systemic impact of liver cancer on the body's immune and metabolic systems. When the liver, a vital organ for detoxification and metabolism, is compromised by cancer, it can lead to an accumulation of toxins and metabolic byproducts in the bloodstream. These substances can trigger inflammatory responses in the skin, eventually presenting as rashes. From a medical standpoint, these rashes can vary in appearance, ranging from small pinpoint red spots known as petechiae, which can result from minor hemorrhages, to larger patches of discolored skin. In severe cases, the rashes may be periodic, causing significant itching and discomfort. This itching is often a result of the accumulation of bile salts in the skin due to impaired liver function. Therefore, changes in the skin should not be overlooked, and patients with liver cancer should seek medical attention if they notice any unusual rashes or itching. We have seen the symptoms that can cause liver cancer when it is grown within the liver itself, and what happens when the tumor escapes outside the liver. What are the ways it can escape? What symptoms can occur if it escapes? Let's answer these questions. When the tumor is already out inside the liver, maybe because it has escaped by one or more of these four ways, liver cancer grows so much that it infiltrates neighboring organs and structures. A tumor breaks the peritoneum and spreads through the abdominal cavity. Liver cancer escapes through the lymphatics or tumor cells enter the blood. Let's see how each of these four ways leads to liver cancer cells. When liver cancer reaches a significant size, it has the potential to infiltrate neighboring structures such as the gallbladder, right adrenal gland, or large intestine. It may also extend upwards to infiltrate the diaphragm, the muscle that delineates the chest and abdominal cavities. This expansive growth can disrupt the gallbladder and bile ducts, impeding bilirubin elimination. Consequently, patients may experience intensified symptoms such as pale stools, dark urine, and aggravated jaundice. Additionally, The irritation of the diaphragm by the tumor can lead to persistent hiccups, which can severely diminish the patient's quality of life. Therefore, it's essential to monitor the growth of liver cancer closely to prevent infiltration of neighboring structures and ensure effective treatment. As the tumor enlarges, it may rupture the liver's capsule and spread into the peritoneal cavity. In this cavity, cancer cells can disseminate and implant themselves on the surfaces of various abdominal organs, which can result in symptoms such as peritonitis characterized by diffuse abdominal pain due to peritoneal irritation. When these tumor implants compress the small intestine from the outside, they can cause bowel obstruction, leading to symptoms such as subocclusion or complete intestinal obstruction. Therefore, it's critical to monitor the progression of liver cancer closely to detect any potential spread into the peritoneal cavity and promptly address any resultant complications. Liver cancer can also metastasize via the lymphatic system. Initially, cancer cells often accumulate in the lymph nodes around the hepatic hilum, where the liver's blood vessels and bile ducts converge. This nodal involvement can lead to symptoms of bile duct compression, blocking the bile flow and causing an increase in blood and urine bilirubin levels. As a result, feces may lose their brown color and appear pale or white. Subsequently, cancer cells can spread to more distant lymphatic regions, although these metastases may not always produce noticeable symptoms. Therefore, it's essential to monitor liver function closely in patients with liver cancer to detect any potential lymphatic spread and promptly address any resulting complications. Liver cancer can spread through the bloodstream to distant sites such as the lungs and bones, causing metastases. Lung metastases may present as multiple nodules and lead to symptoms such as breathing difficulties, persistent dry cough, and hemoptysis, coughing up blood, if a blood vessel is involved. On the other hand, bone metastases can cause severe pain, particularly if the tumor invades and disrupts the periosteum or compromises the structural integrity of weight-bearing bones. Vertebral involvement can lead to back pain and, in severe cases, spinal cord compression syndrome, causing various neurological symptoms as demonstrated. The progression of liver cancer, whether within the liver or metastasized to distant sites, can manifest a plethora of signs and symptoms, necessitating a vigilant and comprehensive approach in its diagnosis and management. Therefore, it's crucial to monitor patients with liver cancer closely and promptly address any metastases to achieve optimal treatment outcomes. To learn more about this topic, please like this video and subscribe to my channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe